Hi, my name is Kiersten Jones, and today I'm going to be discussing the impact of COVID-19 on LGBTQ plus student mental health. So prior to COVID, LGBTQ plus students already experienced mental health issues at a higher rate than other groups of people. And one study showed that an average rate of 28% of LGBTQ plus people recorded mental distress. However, after the pandemic and as the pandemic began, there were studies done that showed that LGBTQ plus students experienced higher rates of mental health than they did prior to the start of the pandemic. So one study showed that across all categories of LGBTQ plus identities, 61% recorded prevalence of frequent mental distress, 65% recorded prevalence of anxiety, and 60.4 recorded prevalence of depression. Now, amongst the category of sexual orientation, those that showed the highest level of prevalence were those identifying as pansexual, demonstrated frequent mental distress at 71.2 and depression at 68.2, and those identifying as queer demonstrated 71.2% of anxiety. And regarding gender identity, transgender students express the highest rates amongst all categories under gender identity of the three studied mental health issues, with frequent mental distress at 79.1, anxiety at 76.7, and depression at 74.4. And here I've included in the middle of the slide just a infographic that I found discussing the intersection of BIPOC and LGBTQ plus student mental health. So we don't have as much time to discuss the intersectional identities related to being a person of color and also identifying as LGBTQ plus, but there is evidence that there are higher rates of mental health amongst these intersections of identities. And I would urge you to look more into this and look at the Mental Health America organization, where I found this infographic. And next, I'm going to discuss how are we going to address these issues of higher rates of mental health amongst LGBTQ plus students. So as administrators, as people working within a school district, I would urge you to create anti-bullying policies that are inclusive of LGBTQ plus student concerns, because we want to make sure that when we have LGBTQ students plus students come into the classroom, whether virtually or in person, they feel comfortable and accepted in their school environments in order to learn as best as possible. And by creating specific policies regarding anti-bullying, that can help prevent and create clear boundaries and make it so that LGBTQ plus student issues are also recognized within school policy. I would also suggest that you provide students with time for self-care and wellness in order to help them deal with issues of mental health, and provide time within the school day, within the school year, a place, a few moments to allow them to take time for self-care when going through these mental health issues, and even just throughout the year in general. And finally, I would recommend providing students online on the website, on your school's website, the district website, or in person in a classroom in the main office that has resources regarding mental health and LGBTQ plus issues, including information from the Trevor Project and the National Suicide Prevention Lifeline, which I've included a link to the Trevor Project and the website link and phone number of the National Suicide Prevention Lifeline. Thank you. Please reach out with any more questions or ideas. Again, my name is Kiersten Jones. You can find me at kiersten.jones@ed.gov or kiersten.jones17@gmail.com. Thank you.